We are back on Morning Line. Thanks for joining us. With us this morning is Dr. David Edwards. He's a doctor from over at Vanderbilt, a pain management expert, and appreciate him coming on as we talk about opioid epidemic and the addiction issues that are out there. We can take your phone calls if you want at 737-7587. Let's take another call or two here from, we've got one from George. George, good morning. Hi, George. Sometimes you come back from the break and you catch him off guard. Are you there, George? All right, we'll come back and try George in just a second. Let's try Brian. Hi, Brian.
Good morning.
Good morning, Brian. What's on your mind?
I feel for Jessica. Let me tell you, I was listening to Jessica. When are they going to bring up more therapy? My sauna, the spa. I was like, when are they going to do it? This poor girl. So for the immediate thing she needs to immediately do, this guy's a doctor. But the first thing she needs to do is twice a day when I hurt my shoulder training with the samurai. I didn't like those pills. They made me nervous and stuff. And, I had to take a couple of them, but I preferred, but I didn't like them that much. And the hot water pouring on your back and stretch a little bit. And then if you can sit down, if you got the sauna in your tub in there, and stretch a little bit. And then but you got to do it like twice a day for 15 minutes. Your water bill and your deep bill, you're going to be in there 20 minutes. I recommend that totally, very much so. Oh,
that's great. So it worked for you. You did take the pain pills and you didn't like the way they made you feel?
Oh, they made me nervous.
Yeah.
Freaked out. I mean, other than that, she could move to a medical marijuana state and she'd feel better real fine without having to get heavily addicted pills and stuff.
There you go. Now listen, I was waiting if someone was going to bring it up, and Brian, he's a sharp guy, did. And obviously here in Tennessee, I mean, there's some forms, I guess, of medical marijuana that are becoming a little more accepted here, but other states have passed legalizing marijuana. And are there applications, in your opinion, down the road for marijuana in pain management?
I think there definitely will be. There definitely is some basic science research that supports the analgesic or the pain relieving properties of marijuana and marijuana substances. Our body creates its own marijuana.
See, I didn't know that.
Yeah, we all have endogenous cannabinoids, just like endogenous opioids in our bodies.
And they serve a variety of purposes? Is it with relation to pain management?
Part of it is controlling your body's pain systems. Part of it is controlling your body's learning systems. There are cannabinoid receptors in your uterus that help with fertility and development of the fetus.
I'll tell you, you hear more and more about how NFL players in a sport that is incredibly violent and causes a lot of trauma to the body talking about, in some locker rooms, there have been bowls full of pain pills. And they're like, you know what, that's addicting, it's bad for us overall long term, we don't want that. And they say, boy, legalizing certain types of marijuanas to assist with our pain. And no one out there is going to be able to convince me that marijuana is more harmful to you than any opioid on the planet. It's just, you're wrong if you believe that. And has anyone ever died from a marijuana overdose? No.
Highly unlikely.
I'll just answer that for you. No. Can you become addicted to marijuana? That's debatable. You could perhaps mentally. There may be some physical links to that. But I just wonder when the time will come when, I'm not saying, it's perfect if you don't have to take anything. But if you gave me a choice right now for pain management, and you can have an opioid or smoke this joint, I'm taking the joint 100% of the time, and I'm doing that here in Tennessee. I'm sorry, it's ridiculous. Opioids are dangerous.
Yeah, you can die from an overdose on opioids, and it's rare to have problems with high-dose marijuana. It's usually not marijuana alone that causes it.
Yeah, there's something else that goes with it. All right, well, let's go to, let's see, we have George. George, good morning.
Good morning.
Hey, George, what's on your mind?
Well, I'm probably an unusual person. Back in 1967, I was laying in a military bed in Texas and couldn't get me out of pain. The morphine, nothing was working. They gave me codeine, and I pretty well been on codeine for 50 years. Wow. I've had multiple back surgeries and neck procedures and all this kind of stuff in my knees and legs. And I have never had a bad instant with it. I've always took it the way the doctor said take it. But now I've never had any kind of nervousness, any beating of the heart beat going up or anything like that. And right now I take a couple of time release Oxycontins every day, 60 milligrams, and then I've got 330s that I take. because they don't last the 12 hours they say they would. But
wow. So you don't think you've developed a tolerance then? You've followed the doctor's guidelines and you've been fine.
Well, I have never in my life, maybe twice, have I ever got lightheaded with when I took the increase in dosage that one day. But I don't, start cramming them things down. As long as I take them the way doctor said, I've never had any problem. And I work farm equipment. I have no wrecks. I have no police report or anything.
Sure,
it never affected me one way or the other except giving me my pain relief.
And it takes care of your pain. Okay. Yeah.
It does, and I haven't had any bad experiences whatsoever with it.
There you go. What do you think of that?
I think that sounds like a really good patient. He's doing what he's prescribed to do. He's maintaining his function. A lot of us who prescribe pain medicines now really are focusing on the function. Are you able to do the things you need to do? If you have chronic pain and there are no surgical interventions for you, if there are no cures in the long run, we have to individualize your care. And I think that at some level, if we don't have any other options, opioids at a low level, if you're functional, are okay.
And it's worked for him. And he's someone who's taken it most of his life. I think he's one of the patients you talked about earlier that may have to sustain and be on it because without there's no cure for his pain.
Right.
So it's chronic, and he has to be on this, and it works for him. And I believe him, and that's a great example. So he may just be one of those unique individuals too, genetically, his mental makeup and all that. Someone else may not have the same result.
That's why we need to individualize it.
Yes.
Now he did mention some of his doses there, which his body's used to.
Yeah.
And those are actually pretty high doses.
Are they?
Yeah.
Okay.
So caution for everyone is when you get up to the higher doses, when you get over about 100, we call it milligrams of morphine equivalents. We can take all these different kinds of opioids, but when we match them all together, we can grade them and rank them by morphine equivalents. So when you get above a level of about 100 milligrams of morphine equivalents, your risk of overdose and death is multiples.
Wow. All right. Let's go next to Cindy. Hi, Cindy. Are you there, Cindy?
Yes. How are you, Nick?
Hey, good. Go ahead, Cindy.
Okay. All I wanted to say is I understand exactly what people are saying, but the thing you're forgetting about, I know a lot of people that claim they're crazy, and the reason why they did that is because they didn't want to work. And they're all the time trying to sell me morphine pills, hydrocortisone, Oxycontin, lithium, for God's sake, lithium, and Seroquel, anything that they can get their hands on. And so I tell them, don't come by my house because I don't do that. If I'm sick, I go to the hospital, the emergency room or something, because I got COPD and stuff.
Yeah.
But I sure ain't taking that garbage that was prescribed to them. And why do they get 25 different kind of painkillers like lithium that's like Thorazine?
No, lithium's a salt. That's right. It's a little different mixing lithium in there. But what her point too, I think, is more about we're too quick sometimes to ask for a pill to cure our pain when maybe a little rehab or something and a little bit of toughing it out might be a better alternative.
Right.
Nah, everyone's different. And
she made the point of diversion of these medicines. That's a big problem, and that's just another. What we talked about earlier, the amount of pills and prescriptions that are available out there, and then they get diverted to those people who weren't prescribed these pills, and those are the ones that are having problems. A good proportion of them.
I agree. Let's go to Marilyn. Hi, Marilyn.
Hey.
Hey, good morning.
Good morning. I'm calling to see, I have a lot of pain, and I can't hardly get around. And I'm wondering if a good massage chair.
That's it. You have back pain then, right? Is it muscle pain, or is it you think it's your spine or your nerves? What do you think it is?
I have stenosis of the spine, and I've had one surgery, and I don't want another one.
Are you on any pain pills?
I have a prescription. I take mostly Motrin, and I do have gabapentin.
Very good.
And I'm scheduled for a steroid injection, but I've had those, and I know that they're temporary.
Yeah.
And I'm wondering if, like I said, I have bad circulation, and one day where I had the side that they did that laminectomy on, it kind of deadens the nerves in my legs and my foot. Lots of trouble walking because I never got my feeling back in that leg good.
All right. What do you think? She's looking at massage? I mean,
You know, there are so many options available to us to try that have so few downsides.
yeah.
Think about it.
Well, acupuncture?
Acupuncture, massage. We group these, and we call them alternative, and we're just not familiar with the potential benefits of these things. But they have so little downside that if you have these available to you, sometimes you have to pay for them out of your own pocket, unfortunately these days. But a massage chair, acupuncture, aquatherapy, treadmill, whatever you can do to keep yourself active and mobile, that's the cure.
Yeah, and I think his point there too is a good one. It may not bring you the relief you want, but it's not going to hurt you. As long as you don't go to a masseuse who's really busting you up. But I mean, sitting in a massage chair or going in a hot tub and letting that jet, hit on a tender spot or something like that gently, it's going to feel good, I would think. It's not going to hurt you. It may not help as much as you'd like.
Our studies and our research are starting to show that these things have benefits in certain groups of people. So that's just teasing it out for you individually as a patient. Which one would work best for you?
Let's go to Benny. Hi, Benny.
Hey, Nick.
Hey, good morning.
I've been in pain for 26 years, Nick. I was diagnosed with fibromyalgia, and I'm going to give you a quick list here. From T1 down to S1 in my back, I've had surgery.
Wow.
And now I'm at the point that I'm thinking of having surgery again. I am going to a pain clinic, and he gave me 8 different shots in my back 2 months ago, which relieved the pain, but not for very long.
Yeah.
I take 260 milligram MS cotton morphine a day, 20 milligram oxycodones a day. That'd be 4. I take Flexeril, my back 3 times a day, 10 milligrams.
Yeah.
And I also take 150 milligrams of Lyrica 2 times a day for the diabetic neuropathy in my feet. And I was wondering what kind of injections can I go to? I think he put steroids in my back first time.
Like
I go back
cortisone?
on the 22nd, get my injections again. But they've made it so difficult for people that's living with pain, and I'm on disability, to get their medication.
Oh, I can. Hey, Benny, I'm just curious, and I'll let the doctor answer your question, but when you take all those pills you described, do you have any side effects from them? Anything that, affects you otherwise?
Yes, sir. I've dealt with depression in the past, and the Lyrica will cause that, and it make you cry. You'll sit here and cry, and then I'll say, well, it's the Lyrica.
Okay.
Get my thoughts on something else. I've tried water therapy, massage therapy.
Sure. You've tried it. Well, let's see, Doc. What do you think?
Sometimes, a lot of us have gone through these major surgeries. Sounds like a very, very involved surgery that can cause chronic pain. And the procedures that are done in pain clinics, a lot of people are going to have pain for the rest of their lives, and if they can find some maintenance and transient or short-term relief from these injections, and that's okay for you if it keeps you going and keeps you moving. But at some point, if that's not working for you, or is not lasting long enough, you should consult with a surgeon again.
He's going to do that, I guess.
He's going to do it, and it's always good to be educated. I always recommend that every patient, it doesn't harm you to go to a doctor just to be educated about the options. So go there, talk about your individual case, talk about these medicines that are causing these side effects like depression, and maybe that medicine isn't the particular one for you.
We'll go to the break, but as we do that, what % of the population suffers from some form of chronic pain, would you guess? You probably don't have the... Is it 1 in 4, 1 in 5?
So about 12 million Americans right now suffer from chronic pain.
Chronic pain, like this last caller. Imagine that every day, every waking hour, you're feeling some kind of ache or pain that you can do nothing about, and that's awful. And I'm sympathetic, and I understand why people are seeking relief.
Yep.
You know, well, as you sit right there right now, are you feeling any pain besides having to put up with me?
Slight headache from my lack of caffeine.
Oh, we'll get you some. All right, we'll take a break. We'll be back. Our final segment. More with our guest. More of your calls right after this.